The Golden Age of Baghdad, spanning from the 8th to the 13th centuries, was a period of remarkable intellectual and scientific growth, with medicine emerging as one of its most advanced fields. Under the patronage of the Abbasid Caliphs, Baghdad became a global center of knowledge, where scholars merged ideas from Greek, Persian, and Indian traditions. This fusion, combined with new research and clinical observations, led to significant advancements in medicine that influenced the Islamic world and Europe for centuries. Baghdad as a hub of knowledge. Baghdad was founded in 762 by Caliph al-Mansur and quickly developed into a cosmopolitan city, renowned for its scholarship. One of its most significant institutions was the Bait al-Hikmah, House of Wisdom, established by Caliph Harun al-Rashid and expanded under his son al-Mamun. Here, scholars translated important texts, including medical works by Hippocrates and Galen, while also advancing knowledge through research and empirical observation. Merging and advancing medical knowledge. Islamic medicine was built on earlier traditions but did not stop at preserving ancient texts. Physicians in Baghdad critiqued, expanded, and refined the ideas they inherited, incorporating knowledge from Persian and Indian medical practices. They emphasized the importance of clinical observation, developing more sophisticated methods for diagnosing and treating illnesses. Figures Al-Razi, Rhazes, 854 to 925. One of the most significant physicians of the Golden Age was Abu Bakr Muhammad ibn Zakaria al-Razi, known in the West as Rhazes. Born in Persia, al-Razi became the chief physician of the Baghdad hospital and authored numerous medical texts. His most influential work, Kitab al-Hawi, the comprehensive book of medicine, compiled medical knowledge from various cultures and integrated his own clinical observations. Al-Razi made groundbreaking contributions to medical science, particularly in differentiating between smallpox and measles. His clear descriptions of these diseases allowed for more accurate diagnoses and treatments. Additionally, he was a pioneer in hygiene, advocating the use of alcohol as an antiseptic and emphasizing cleanliness in medical practice to prevent infection. Al-Razi also played a key role in establishing the principles of medical ethics, urging physicians to be compassionate and prioritize the well-being of their patients, an approach that laid the foundation for modern medical ethics. Ibn Sina, Avicenna, 980 to 137. Another towering figure in Islamic medicine was Ibn Sina, known in the West as Avicenna. His canon of medicine became one of the most influential medical texts in both the Islamic world and Europe, serving as the foundation for medical education for centuries. The canon of medicine was revolutionary in its systematic approach to diagnosing and treating diseases. Ibn Sina expanded on the humoral theory, which maintained that health depended on the balance of bodily fluids, while also introducing new methods of diagnosis. One of his most important contributions was the concept of contagion and quarantine, recognizing that certain diseases could spread through contact. This understanding of disease transmission was ahead of its time and influenced the development of epidemiology. Ibn Sina also made significant advancements in pharmacology, documenting numerous medicinal plants and advocating for testing drugs through empirical observation to understand their effects. His work laid the groundwork for the development of modern pharmaceuticals, hospitals, and public health in Baghdad. The Abbasid Caliphs invested heavily in public health infrastructure, establishing some of the world's first modern hospitals, or bimaristans. These hospitals were not only treatment centers, but also institutions of learning, where students could observe and train under experienced physicians. One of the most famous hospitals in Baghdad was built by Caliph Harun al-Rashid. Baghdad's hospitals were highly advanced for their time, featuring specialized wards for different illnesses, including surgery, internal medicine, and mental health care. They provided free healthcare to all citizens, funded by charitable donations. The hospitals also served as teaching hospitals, where medical students could learn through direct experience, ensuring that knowledge was continually refined and passed down through generations. Surgical innovations. Islamic surgeons in Baghdad made significant contributions to the field of surgery, building on techniques from ancient Greece and Rome. One of the most influential figures in this field was al-Zahrawi, Abul Qasis, whose medical encyclopedia, Kitab al-Tasrif, described numerous surgical procedures and instruments, many of which he invented. Al-Zahrawi pioneered the use of cauterization and developed sutures, both of which are still used in modern surgery. Other notable surgeons, including Al-Razi, contributed to advancements in surgery by developing procedures for treating bladder and kidney stones and promoting the use of mercury as an antiseptic. These innovations significantly improved surgical outcomes and set the stage for future advancements in medicine. Innovations in pharmacology. Islamic scholars in Baghdad were also pioneers in pharmacology, the study of drugs and their effects. Islamic pharmacists, or sayadila, developed sophisticated methods for compounding medicines using herbs, minerals, and animal products. They applied empirical observation and experimentation to improve treatments. One of the most important works in pharmacology was al-Biruni's Kitab al-Saydala, Book of Pharmacology, which documented hundreds of medicinal plants and their uses. Al-Biruni emphasized the importance of testing and refining medicines based on their effects on patients, a principle that laid the groundwork for modern pharmaceutical research. Influence on Europe and legacy. The medical knowledge produced during the Golden Age of Baghdad had a lasting impact on Europe. After the decline of the Abbasid Caliphate, many Arabic texts were translated into Latin, and works like Ibn Sina's Canon of Medicine and al-Razi's Kitab al-Hawi became standard texts in European medical schools during the Renaissance. Baghdad's hospitals also served as models for European healthcare institutions, particularly the concept of teaching hospitals and the provision of free healthcare, both of which influenced the development of Western medical systems. Conclusion: the Golden Age of Baghdad was a period of extraordinary progress in medicine. Pioneers like al-Razi, Ibn Sina, and al-Zahrawi made lasting contributions to medical theory, surgery, and pharmacology. Their emphasis on clinical observation, hygiene, and ethical treatment laid the foundation for modern medical practices. The influence of Islamic medicine extended far beyond Baghdad, shaping healthcare systems in Europe and leaving a legacy that endures to this day. 4.